And welcome to the West Islip Senior Center here in our wonderful town of Islip. I'd like to thank our distinguished guest here this morning, Senator Kirsten Gillibrand, for joining us with an important announcement about 3 bills that will help Americans afford prescription medication. Also joining us today is Suffolk Independent Living Organization, SILO, their Chief Executive Officer, Joe Delgado. You know, I think each of us in some way or another have come to recognize in the past year, and it's been a year like no other, just how important it is to maintain good mental and physical health. Here in the United States, we have a serious problem providing affordable prescription drugs to residents. Approximately 73,000 residents in the town of Islip are over the age of 60, and we have a population of 330,000, so that's quite a sizable chunk. And it's been a particularly difficult time for them. You know, we're here at the Senior Center that usually is bustling with activity, and today it's empty. But there is hope. May 3rd, they're coming back outside, and they're all very, very excited about it. When 1 in 4 Americans can't afford their medicine, when 3 out of 10 adults say they haven't taken their medication as prescribed in the past year because they can't afford their medication, and when approximately 19 million people say they or someone in their household has imported a drug from another country to get a lower price, we know something's wrong. And thank goodness the Senator is helping us address that. I'm sure that each and every one of us here today has a family member or knows someone who needs to take medication daily. Failure to take that medication as prescribed can lead to unnecessary pain, suffering, and even premature death. If enacted, the Senator's bill will ensure, and I want to say when enacted, how's that?
Yes, let's say
Okay,
it.
when enacted, the Senator's bill will ensure that prices here in the United States are on par with 5 other countries, and it will reduce the cost of medication by 50%. That is literally life-changing. It will ensure that our loved ones and our residents are able to maintain their physical and mental health, and that is critical now more than ever. So I'd like to thank Senator Gillibrand once again for coming to West Islip, to coming to our town, for shedding light on this important issue. And now please turn it over to Senator Kirsten Gillibrand. And thank you.
Thank you so much. Well, thank you to our supervisor, Angie Carpenter, for her leadership. I also want to recognize the West Islip Senior Center for hosting us, and the Suffolk Independent Living Organization CEO, Joe Delgado, for joining us to talk about this issue. The cost of prescription drugs is a huge issue for Long Island. Americans pay the highest prices in the world for prescription drugs by far. Now, 1 year into this pandemic, millions of people have lost their jobs and insurance or are earning less, making it even harder for them to afford basic medications that they need to stay alive and to stay well. And while families have been facing unprecedented financial insecurity, drug makers have actually raised the prices of more than 860 prescription drugs and made billions of dollars in profits. This is an issue that affects so many people. 30% of adults have said that they have not taken their medicine as prescribed in the past 12 months due to the costs. New Yorkers are being forced to make impossible decisions between picking up their prescriptions and buying groceries. Healthcare is a human right, not a privilege. But right now, life-saving medicine is only life-saving if you can afford it. That has to change. I talked to a young woman who is forced to ration her insulin, which can be deadly, because she couldn't afford the exorbitant price. I've also talked to older adults who struggle to pay for their medication. Just last week, I spoke with a senior who needs eye drops for his glaucoma that costs him thousands of dollars a year. I also talked to a retiree who has multiple myeloma. She can remain in remission if she takes her medication every day. But that medication can cost up to $200,000 a year. Even with help from Medicare, the portion of the prescription drug cost that seniors are responsible for can be overwhelming on a fixed income. Nearly 9 in 10 older adults takes prescription medications, and 1 in 4 say that it is difficult for them to afford them. This is a health crisis for our older adults, who account for 1 in 6 Suffolk County residents, and addressing it is one of my top priorities as a member of the Aging Committee. That's why I'm supporting a package of 3 bills that I think can reduce the cost of prescription drugs to make sure everyone can buy the medicine they need. First, the Medicare Drug Price Negotiation Act would allow the Secretary of Health and Human Services to negotiate for lower prices for prescription drugs under Medicare Part D, the way that the VA and Medicaid already do. Because they are currently prohibited from negotiating, Medicare pays on average 3 times more than Medicaid for the same top-selling brand drug. If Medicare could negotiate for lower prices, it would save the government and our seniors money. In fact, CBO projects that implementing this policy, which 88% of Americans support, would save the government $456 billion over 10 years. That's money we could use to help address so many challenges New Yorkers are facing right now, from access to health care to affordable child care. President Biden and congressional leaders have already discussed using this policy as a way to pay for parts of the upcoming infrastructure package. The package also includes 2 bills that would help level the market for Americans purchasing prescription drugs by pegging that price to the prescription drug costs in Canada, the UK, France, Germany, Japan, and by allowing patients, pharmacists, and wholesalers to import lower-cost drugs from other countries. These are the common sense reforms that I believe will make it more affordable for more of our families to afford the medicines they need. Our next speaker is Joseph. Let me just get his title. Joseph Delgado, Chief Executive Officer of Silo.
I'm honored to share the podium with Senator Gillibrand.
Thank you.
Supervisor Carpenter. Thank you so much. I'm Joe Delgado. I'm the CEO of Suffolk Independent Living Organization. Independent Living Centers are a national initiative. There's 300 of us throughout the United States that provide services for people with disabilities. Senator Gillibrand, throughout her career, has been a supporter of families from the very young to the senior community and a strong advocate of people with disability, and I thank you for that, Senator. Which is why I stand here with her and others to welcome and support this remarkable legislation, whose intent is to help bring down the cost of prescription drugs. People with disabilities in the senior community are the largest group of Americans needing the benefits of prescription drugs. And yet we struggle, to be able to attain or acquire medication sometimes because of our financial resources. Sometimes we place our lives at risk because we have to meet other financial needs. You either pay for the apartment, or you may either make the rent payment, or you buy your medication. Sometimes you can't do both. And thereby we forgo buying the medication we so desperately need. This legislation will help towards that end and provide us with the means to remain independent and living in our community. Again, research has shown that an individual living in their community, instead of a nursing home, instead of a hospital, has better mental health, and it also saves a lot of money to the community, to the government. And so I thank you, Senator Gillibrand, for moving this vital piece of legislation forward so that we can be able to acquire and attain prescription drugs at a much lower price. Thank you.
Thank you. I'm going to give you a couple just examples because this is helpful for your stories. I'm going to give you some examples of common drugs. I don't know these drugs, but you would. Januvia for diabetes, which costs $586, would cost under this plan $293. Vimpat for epilepsy, which costs $1,193, could cost $597. Pristic for depression, which costs $276, could cost $138. Eliquius for blood clots cost $571, could cost $286. Spiriva for chronic obstruction pulmonary disease cost $553, could cost $277. So that's just an example of the kind of savings that people would have if you got the lowest price for these drugs. But thank you. God bless you all.